staff doesn't have the opportunity to be in these meetings, but we want them to hear what we're saying. And so that's why we're recording it. We're also showing it live. People can watch this at their desk if they're working. It's also archived, and it's placed on that portal that we created for the employees. Right, so everything we do is recorded and available and is transparent. And that's one of our goals in working this issue. So, welcome here this morning. I'm Peter Zanoni, City Manager. And today we have a couple things. This week's kind of been a busy week at the Council and Commissioners Court side. And so I'm going to try to brief you on that. We'll talk a little bit about the positions, those 5 managerial positions, and the director, how we're doing in those postings, and then interviewing for other positions. Chris and Valencia are going to talk a little bit about the work teams. Those all met, except for one, for the first time this week. There's 8 work groups in total, outside of the focal area groups where you, the programmatic work groups, right? And they all met for the first time this week, so Chris will kind of do a debrief on that and talk about next steps for all of them. And I think that's kind of the agenda for today. And then I do have a couple questions to ask the group here today, so we'll do that as well through the meeting. Let me see, there was one other opening comment. Well, let me just introduce the team here. We have Steve Vieira, Assistant City Manager. Yvonne McCaney, our HR Director, she's going to talk a little bit. And who else do we have? Chris and Valencia, Miles Risley, our City Attorney. And then we have Francisco Zamora, who's here, kind of an Assistant County Attorney, second person in charge in the county. Jenny won't be available this morning. So, and then before I get into the agenda, I just want to remind us kind of the 3 or 4 guiding principles and what we're doing, right? One is better health outcomes for the community. We need a healthier community, and public health is a big part of that. You guys are a big part of helping our community have healthy outcomes, and so we want better health outcomes for the community. We want better utilization of our tax dollars that are dedicated. It doesn't matter if they're local tax dollars, state, or federal. We want to utilize those better, eliminate redundancy and efficiency and misuse of monies. That's an important goal. And then the third one, which is most important, and I think I like the best, and I hope you all do too, is better work environment, right, for the over 100 public health employees at both city and county. That is a big goal for us. We think that this environment here can be much better, and that's something that I focused on in my 2+ years with the city, is making sure the city or the county in this type of relationship is someplace where people like to go to work every day. I love going to my job every day, and we want our employees to have that same enthusiasm, right? And so your workplace environment, the ability to be transparent on the job and have a fair environment is something that we want for you all. And then we're doing that simultaneously knowing that there'll be no interruption in service, right? So we're taking care of Omicron, right? Everybody, are we taking care of Omicron?
Yes, sir.
Right? Our case count, is Lewis here this morning? No, our case count is still generally in the 40s, I think. I think it was 50, was it 50 yesterday? That's generally holding steady, which is good. So we're taking care of public health, and at the same time, we're going to try to transition to a city health department where we'll have those 3 things: better health outcomes, better tax utilization of tax resources, and better work environment. So no interruption in service. That's the pledge that we've made. Okay. So let's start with this week. I'm going to, the next couple minutes here, we're going to just focus on the timeline for the week. I understand Monday the judge came here to speak to you all. And in part, that's why I want to ask you a question here in a moment about how often do we want to meet? We may be meeting fatigue at this point, right? But I just want you to know that Monday when the judge came here, I was unaware that she would be here. And I asked her, can you tell us in the future so at least we can have representation? Steve would have been here, I would have been here, Chris would have been here, but we didn't know, I didn't know that meeting was taking place. So I just want to let you know that. That's why you didn't see me or Steve or Chris or Yvonne. So that meeting took place Monday. I don't know what was said because it wasn't recorded and the notes weren't shared with us. So just to tell you that as well. And then Wednesday, The Commissioners Court met, we'll talk about that in a moment. And then Thursday, the judge came back, and we didn't know about that either. So, again, we would have been here had we known, or Steve would have been here. So we don't know what was said Monday and Thursday, but I just wanted to share that with you. Okay? So Tuesday, City Council met, using the Monday, then Tuesday, City Council met. We provided them an update on the, or did we provide an update this week at Council? Tuesday, no, not this week, we did last week. So at City Council on Tuesday, nothing happened, right? Yeah, it's been a long week. Wednesday, though, Commissioners Court had an item on their agenda. They actually had a few, but the most important one was a discussion of the city's creating its own department. And that happened Wednesday, so that was a long meeting. Steve was queued up in WebEx to provide information or answer questions if the Commissioners Court had any. I don't think they had any, right? And I was watching it myself, and I think a few other staff members were, maybe some of the City Council members as well, maybe the mayor. But so we're going to try to recap what happened Wednesday. So are you guys familiar with what happened Wednesday? A few of you. So the Commissioners Court did take a vote after a lengthy conversation, and basically what they said, I think it was in the headline in the paper, was the city can be the sole member of the district and provide services to the region, the Oasis County and beyond. Some of our grants go beyond the region. But it seems like, and we're going to be negotiating with Francisco and Jenny today to get clarification on it, but there would be a 6-month kind of stay in place situation, and negotiations would take place, I guess, after the 6 months or around the end of the 6 months. Francisco and I, we're going to try to get it clarified today. And so that's what they approved. The judge said several times that we need to see what type of input we have in the process if there was a city-led district. And to us, that sounds like what we have today. So we have to work through it to get clarification, I think. And we're going to talk to our negotiating team, which is Jenny and Francisco. We've expressed this, and the council have expressed it, that we're willing to make sure there's no interruption in service. That could mean that it's going to take longer than January 18. But we think 6 months is too long. We think that every day matters. If you're in a work environment that's not pleasing, every hour matters, right? Every minute matters. So we're not sure where the 6 months comes from. We're going to be developing, we are developing a more detailed work plan with more specific timelines. So we'll have that available for the county. And so I'm sharing that with you today. We'll be negotiating with the county's representatives. And that's our kind of reaction to it, or at least my reaction to it. And Steve, so we're going to continue to do what we're doing, which is work to set up a separate health department. This is nothing approved by either party at this point, right? The county or the city. And look to see, can we work with the county on this item that they passed on Wednesday. And we said, and some of the conversations I have had with individual commissioners, not just one but several, they have offered that as an option, and Francisco knows that. We've talked about it with Jenny, which is there's kind of 3 options for the county, or the city county, which is 1, the city takes over everything and provides service to the county. 2, the district stays intact with the county as the member. And then 3, the district dissolves and the county and the city set up their own departments, right? So, as of Wednesday, the Commissioners Court vote was to have a city-only district, and we would provide services to the county. But there's details that have to be worked out, and we're not too confident, we're not too sure about what those are at this point. Okay, any questions on that? Yes, sir?
So, first question would be, if the negotiations happen and all sides are happy, does it have to be approved through city council, or can you just sign that, or what's that process like?
Okay, that's great. I'm sorry, remind me of your name again? Kevin. Okay, Kevin's question was, what's the next step? Say if what the Commissioners Court approved in concept on Wednesday, if we agree to that, the city council, what would we do? So there would be right now there's a governing document, a contract that guides the district and has certain parameters that we have to follow with respect to funding, hiring for certain positions. So that document would be amended, and both parties, meaning the city council and the commissioners court would approve a new kind of contract between the two parties. So it would go back to the city council and commissioners court, Kevin, to answer that question.
So if that doesn't happen, or let's say for whatever reason, right, somebody has a problem with it and one side doesn't approve it, January 18th comes, right? I've heard a lot of the health district is dissolved at that point because if there's only one entity, like just the county, the city withdraws, so only the county remains. And this might be a question for the county attorney, but does the health district dissolve and what impact does that have immediately? Do grants cease to exist? Do county services cease to exist? I don't know if that's more for them.
Yeah, well, I'm going to answer and then Miles can jump in from a highly technical legal standpoint. So that question we have asked ourselves as part of the transition. So we believe our legal team, not only represented by Miles, but by an outside attorney as well, that specializes in municipal law, believes that the district exists with one party, and it could exist with two parties, or three. So we believe that by withdrawing from the district doesn't end, doesn't cease. And we think we're even more confident in that because we know the county was saying what you said, that it may dissolve. However, nothing was said from a legal standpoint Wednesday. And we heard that they may try to say that. So we're confident that their legal team, based on silence, thinks the same. Miles, do you want to add to that? So, but Kevin, the 90 days was a provision in the contract. It's obviously going to take more than 90 days to transition, depending on what the transition plan is, given the county's action on Wednesday. So we're thinking that the district will exist and certain services will begin to come over. So things like grants will still be assigned to the district because it still exists. And until the city kind of withdraws from each of the grant programs, the city and the county are still participants in the district. So what we're going to actually get a legal opinion on is it's not going to be that on the 18th, the city's out of it, we're out of the district. It's going to be, and we have to see if this is legally okay, and this is work in progress, and others may say you guys should have the answer, we don't, we're working through it. So it could be that some aspects of the district come over to the department, but the city is still a member of the district in other programs, like grants and some more complex ones. I think that's what we're gonna see if it's legally doable. Miles?
Yeah, you've asked a fairly sophisticated legal question, one that's not susceptible to agreement by probably any of the lawyers in the area. Our position has long been that it doesn't dissolve, that it continues on with one party. But there's no case law on this issue, so the judge's position that it does dissolve is not necessarily a completely unreasonable position. It's just there's two viewpoints on whether it continues to exist, and judges have not agreed on that question because it's a fairly new question.
But so the real, for the staff, what we're trying to avoid is the Cinderella stroke of midnight, things just sort of end, right?
Yeah, now that won't, yeah.
So, can
We're
you
pretty
give us that assurance that?
Right, yeah, right. So as Miles said, there's no case law on this, so unless somebody says, you guys said you were gonna withdraw in 90 days, then you have to withdraw, or we're gonna sue you or something like that, or we're gonna do an injunction or something like that. The way we're looking at it is that the city is gonna be two things. We're gonna be a health department, and we're gonna be a member of the district, piece by piece. So if you're a grant employee, Kevin, what grant are you in?
The STD.
Okay, your STD grant, we're not gonna have that figured out in 2 weeks, right, or 3 weeks. So the city is gonna be the partner with the county and the district, because that function, STD, still remains as a two-party system. However, let's use vital statistics. This is probably one of the easiest ones. It's quite probable where's our vital statistics employees? Are they at City Hall today? They're all working. Right, that's why we're recording this so people can see what's said. We want to be transparent, but so that's an easy one to transition over. So it could be in January. It may not be the 18th. It could be the 25th or some other date. We transition vital statistics over. So at that point, it's no longer a function of the district. and we'll start paying salaries out of the city department. And those positions will report to most likely the city secretary. So it's gonna be a gradual transition. So unless the other party sues us because they don't like that setup, I think we're gonna be okay. There's no federal, I mean, the federal government's not gonna sue us, or the state government, or the citizens, right? We know that we have a business model that was set up 40 years ago, and at least in the last 20 years, the city and the county to some extent have wanted to change it. And that's what this is about. So there's no clean break per se. We could say, okay, we're gonna transition everything on this month, but we don't know for sure, because we have to talk to numerous granting agencies and that type of thing. Okay, yes, sir?
So one of the things that was said was that the city health department doesn't exist in the eyes of DSHS. So there's no entity as the city health department to transfer those grants to.
Yeah, that's inaccurate. I don't know who said that. So, I don't know what council meeting it was, but city council has authorized and approved a health department.
So the city council has, but DSHS has not approved or recognized the city health department as an actual thing. Is there any truth to that?
You know what, I don't know if I can substantiate either side, because I don't know if anybody actually called them and said, hey, we have a health department now. That's something we probably need to do, Steve.
Yeah, that's
we're
one of the
working
things
on
that was
that.
said, that there is no there's no
Yeah.
city health department to transfer those grants to in the eyes of DSHS.
Okay, we'll have to send them the ordinance that showed them the health department. So I don't see why they wouldn't recognize it. City council authorized it. It's approved. We have authorized positions. We have 9 months of budget funding in there. Right. Okay, that's a good, thank you for bringing that up. Kevin?
When will the city health department hire a local health authority?
Right, Kevin's question is the local health authority. We know that's Dr. Ramachan Bruni, and we do have Dr. Ram as the local health authority, because the state law, if the health director isn't a medical doctor, then you have to hire by contract or whatever, a medical doctor to be the local health authority. So this is done in San Antonio, they've gone back and forth, I just know that from working up there, where sometimes the health director was a medical doctor, and so we didn't need a public health authority, but as soon as that person left and we hired somebody that wasn't a medical doctor, then we had to have that public health authority. So we don't have the answer to that question, but that's on the list. So we are going to be recruiting, or the advertisement is probably done at this point. Today. So the advertisement's done. So beginning next week, we'll be using that advertisement as kind of a brochure for the director, and that's available to staff here locally, in the state, and in the country, and the recruiter's gonna help us. So part of that answer part of the answer will be when we hire the health director for the city department, or the city-only health district, if that person's a medical director, we're not gonna need a contract, most likely, with a medical doctor. It does cost money. We're paying 2 people right now, right? We have a health director, and then we spend money to have a medical doctor as well. So if we hire somebody that's a medical doctor, then we can save over $100,000.
When do you anticipate that position to be filled?
It's gonna take at least 3 months. We have 3 of them. Yeah, probably, generally when we recruit, it takes a good 4 to 5 weeks to get a good candidate pool. You can count on about 3 to 4 weeks to interview, travel back and forth, or even here, people have to put things in their schedule, and then about a month to transition. So it's 90 to 120 days. But we know it's critical. But what we're gonna do, just so you know, for the department, if we go that route, as we negotiate with the county, if we go the department route, we're gonna hire an interim, somebody to just interim be in charge, more so of just kind of keeping things organized. They may not be directing much, because not too much will be brought over at that point.
When are you gonna do that?
That is soon, probably by January, early January. We're already kind of recruiting, if you will, coming up with some options. They'll probably be like a contract employee.
I do have a question.
Yes, ma'am.
I noticed that, going on Kevin's questions, the contracts, if I'm not mistaken, because I deal with a different grant, I don't see all the ones that I used to see before in past, but some of the contracts are made out to city with
that's a good point, right? I mean,
So
you're right.
you just need to, I don't know if y'all need to reapply or apply, or because you're already acknowledged as having some contracts that read city and some contracts that read Louis County.
Yeah.
I've seen this for, the labs and, so.
Okay, you're right, Letty.
And
Right,
then the
yeah.
water, I think, I don't know.
Yeah,
but you
okay, that's a
just-
good point, we'll look into that. It already may exist today, right? And there's no real rhyme or reason, Annette, the director, working with her leadership team, have kind of decide what grant goes where. There's no, I don't think there's really much science behind it, or, rigor, or whatever you call it. Yes, ma'am?
Is the 6 months going to push back the job fair, or are you guys still going to go ahead and meet with the team?
Say it again, I'm sorry?
The job fair, is the 6 months going to push the job fair back?
No, so what was your name?
Pamela,
Pamela's asking, is the 6 months gonna push the job fair back? We're not in agreement that we're gonna wait 6 months. So the 6 months is a concept that Nueces County has introduced, and we're not in agreement with it. We don't think we need 6 months to begin to talk about how do we have better health outcomes and a better work environment. So, right now, we're moving forward with the plan we have been working on, that city council approved, which is withdrawing from the district and hiring city employees, a city team. So we posted the 5 managerial positions, and we're advertising for the director starting next week. And so the job fairs will start soon. We're gonna be, Yvonne's gonna talk a little bit about it. She's gonna talk here in a little bit about the next step in the 5 managerial positions when interviews start. So, she's assembling interview teams, that's why we're not interviewing this week. So if we start interviewing next week, early January, then job fairs start as soon as we start filling some of those division heads. Right, that's a good question though, Pamela, right? The 6 months is a concept Nueces County Commission has approved. The city, we're not in agreement with that. But we're negotiating. Francisco, is he here still? Oh, okay. Moving around now. So we negotiate every week, just like we meet with the employees every week. We negotiate with the county. The Commissioners Court have appointed Jenny Dorsey, who you all have met. She's the chief negotiator for the county. And Francisco's her assistant, and he's here today because she's out this morning. Let's just go here, Cedro, and then we'll go to you.
Just, something to keep in mind is you're considering the local health authority.
Right.
Some of the grants and TMHP, there's a requirement for not just the local health authority, but also a provider. So you need to consider that piece as well. For some of the items that the local health authority is not sufficient, you have to have another provider. So for that checks and balance, it cannot be the same provider. So just keep that in mind as you do the transition. I'm just giving you the information
Yeah,
because
that's
the
good.
18th is coming up, so you wanna make
Right.
sure there's nothing that comes up where there actually is a disruption because we didn't let you know.
Yeah. Okay, good. Thank you. And those work groups, tell me your name again. I'm sorry. I know we've met.
Adrian.
What is it?
Adrian with the others.
Adrian, okay. Adrian, I know we've met quite a bit, even out in the field. So Adrian has a good point.
You
That's-
just see the Joker mask. that's-
Yeah. Yes, sir. That's a lot of good information that we got here, but we're gonna get it when we start doing these employee, program area conversations. We also said of the 4 principles, the 5th one is that you all are gonna help us with the transition. It's not us back here doing it, it's gonna be you all. We're gonna guide you to the transition, right? We need your input. You're the experts in the field, you know where, you know about the programs, you know where the assets are, you know who the customers are, so. That example from Adrian is something we'll get in even greater detail when we do these program focus groups. Okay, do we, Cedro, do you have a question? I'm
Yes,
gonna try
I
to
just
cover
had,
it.
good morning.
Yes, sir, good morning.
Yeah, I just had a question involving the transition from county staff to city staff.
Okay.
And I heard you say just now that, when we do the city health department, we're gonna transition into hiring, job fairs and so forth to put these people in place. Is there a projected timeline when those particular positions will be posted? Our staff is very anxious, they're ready to go, and I'm sure they're wanting to see the posting so they can have the first opportunities.
Right, and our employees being city or county or?
Well, our county employees,
employees, okay.
there may be some that wanna switch over
Right.
to city,
Well,
and
exactly.
it's vital to continue to, supply services uninterrupted. We need to make sure that we have those positions in place.
Yeah, we agree, Cedro. So Yvonne's gonna talk a little bit about the process on that, but you're gonna know, we're over communicating with you, that's actually principle number 6, is over communicating. That's why I, as a city manager, are coming here to talk to you every week, and will continue to do so, and I have an open door policy. If you wanna come talk to me, you can. Some employees have done that already, and Steve, we know, has email and telephone, so, right now, there's no postings except for those 5 division heads. As we fill those, and they may not be simultaneously, as we fill 1, 2, or 3 at a time, then we're gonna work with that division head to say, okay, now let's make sure we get the right jobs and post those, but you'll all know sooner than anybody when we do that. And we do understand this angst and anxiety and worry amongst everybody here, so that's why we're trying to over communicate and help you and have you be a part of the solution. But let me just point, so the county employee can apply for a city job. There's no prohibition against that. And the county employee can come talk to me if they want. The judge knows when we're meeting with people, I tell her. The county attorney knows, so we're very transparent. So a county employee can come talk to me, a city employee can come talk to me, and the same as applying for a job. You can apply for a city job if you're a county employee. Okay, let me just look at my notes to see if there's anything else from the week or from yes, sir? Jenny? Okay, Jenny is outside with Miles. Let's see. I just want to see if there's anything else from the notes from the county meeting. Okay, I think that's it. So, Chris is going to talk in a moment, but I'm going to talk about 2 things, and then we're going to see. Then we're going to have Chris give us an update, and then we'll have Yvonne give us an update. So, let's see. What I want to talk about is immunizations, because I use examples all the time here on some of the programs, like Kevin. Yeah, Kevin's example. We use STD. I use vital statistics, but let's talk about immunizations, because several of the staff members have said, hey, what about immunizations? You never talk about them. So I did want to bring them up. So I know we're immunizing people for flu and the pandemic, right? But are we immunizing people, are we back open for immunizations, for the rest of the immunizations?
No, we're not.
We're not? That's kind of what I had heard. So we're not immunizing, like,
If they call in for a shot, we see them, but we're not publicly saying, hey, immunization's open.
okay. So immunizations, I thought we were open, I thought everything was back open, like in October.
It's open, as far as they can call in to schedule an appointment to receive the vaccine, but it's not just the doors are completely open for everybody to just come in. Not on a walk-in basis, it's open on a scheduled basis.
Schedule only. Do we go out in the community, like the rural parts of the county, to provide immunizations, or is it?
We have, the last time.
Did we in the past, I mean?
We go to back to school, but we haven't in the last month or so.
How many people have work in immunizations? Quite a few of you.
So we did the back to school program, so generally, the county is handled in phases. So generally it'll be during the back to school or any other type of, occasion. And most of that is centered around back to school vaccines. We don't go out there for like the adult immunizations. It's not really a high priority. The immunizations is mostly centered around children. So generally it's focused around back to school time. And so we do work with those counties, and a lot of times it's upon request, something that the commissioners have set up. Hey, I have set up with these schools, can you come to my area for these? And then sometimes it is the school or AHEC that will contact us and say, hey, we're trying to work with these schools to get back to school vaccines provided, can you help us out? And then we work with them, they'll set up the venue, and then we'll go and provide those vaccines.
Did we do the fairs this year? Like, school started back in March.
Yes. Yes, we did.
Some, but we're not as open as we thought, so, right, that's what some of the employees were telling us this morning. That we're not fully 100% back to where we were 2 years ago when we kind of transitioned everything because of the pandemic. But we want to be, right, so we're going to have to talk to Annette and Luis about getting our immunization program back on track. Is there any reason we shouldn't be immunizing people for other things other than flu and COVID? We don't see any reason why, right? Okay, well, Steve has it on his list, we need to talk with Annette, or Louise, to see why are we not open when it comes to immunizations for children, or middle-aged or adults, right? How many types of immunizations do we give out? We were looking at,
We have
a lot.
Because we also have the adult safety net, which is for adults, anybody that's 19 and over,
Okay.
that has no health coverage, we can see them as well.
Okay.
And we also have some on the private side for people who travel, like we have yellow fever and
Oh,
typhoid.
right.
And we get quite a bit of calls on that.
Okay,
Mhm.
but we're not, we appreciate you telling us this morning, so we're not 100%, doesn't sound like we're much percent at all in immunizing people. Basic health, public health program we're not doing.
Peter, actually, that's not 100% true. We are open, it's,
Yeah.
like I said, it's by appointment only though.
I know, but
So
before we used to
are
actually.
providing those vaccines, it's just by appointment only, and I can give you the background as far
Okay.
as why the decision was made.
Okay.
Annette, because we do get other requests for COVID-19 vaccine, where the teams, the strike teams, and the temps are already, being utilized.
Right.
So, in order to not tell those people no, she wants the vaccine, the immunization staff to be available to go do those COVID-19 vaccines on those call-ins that come on the side from what we already have scheduled with the temps. So that's the reason why she didn't wanna open 100%, hey, we're completely open, it's only by appointment only.
Okay, well, let's look into
That's
it.
the background.
So we got a lot of employees that seem to be anxious to want to be providing that again at 100%, but we're not, so. Steve's gonna, we'll talk to Annette and Louise. Okay, good. Anything else from the immunization group? How many people work in immunizations, Darren? You may not all be here. I know there's about 5 people raised their hands.
We're 8 of us.
8? Okay.
But our program manager's out on medical leave.
Out on medical leave? Okay. All right, have they been out for a while, or
She's been out since July.
since July? Okay, we need to look at that too. Okay, so I'll use it, the reason that we're talking about this is the employees were getting on me for never mentioning immunizations. It's a big, right, it's a big program, like, hey, we do more than just, STD and WIC and those other programs. Okay, good, then the other concept I wanna talk about, this is actually, getting input from the employees from these meetings, is getting input from you all outside of the 2 ways we have right now, or 3 if you take these type of meetings. So you can talk to us here, you can talk to people in their offices like me or Colin, and then we have the 2 types of focus groups, the 8 areas that Chris is gonna talk to us about, and then we'll have the programmatic areas, right, your individual programs like immunizations and WIC and so on. But some employees say, can we get some type of a anonymous Dropbox, if you will, a suggestion box of how we can give you positive input on how we can recreate the department, or just share information with you on things that you might want to have changed, or issues in the current setup that you think you might want to tell us about. So we want to, with the team, since this was brought to our attention some time ago, have developed 3 alternatives for you. I want to see what you all think, if you need all 3 or if one works. Those alternatives would be, everything would be confidential. So one would be the traditional, like a ballot box, where you handwrite or type out something. You can put your name on there, you don't have to, you put it in the box, that's one way. Another way is through technology, and there's numerous ways there, but one of the better ones is a QR code type of a program, where you scan a QR code with your phone, and then a software application comes up, and you would type in the note or the message of the concept, the improvement, the issue that you might have that you want to tell us about. And that would be sent to some type of a program anonymously, so we won't know. The QR code is most anonymous. Well, actually the paper one is too, although somebody could see it then, but the QR code would allow you to use your phone or your computer at work or at home. I think, can you use your computer, QR code?
Well, there could be a link as well, so you could just click.
A link to the phone, okay. And then a third way would be a hotline. So we have the audit department, we have a city auditor. The county has an auditor too, but the city auditor is probably who would use. Or the human resources department has a hotline. And there's a live person, right? Or do you leave a message, or is it a live person?
It's a general mailbox, where you can either
Okay.
anonymously, or you can press the number and speak to them.
Okay, so you can leave it as a voicemail, or you can speak to somebody. So we think this might be a good idea. It's coming from you all, and you're telling me, hey, we want some additional avenues. Did you want all 3 avenues?
Yes.
All 3? Okay?
Yes.
Okay, so we'll do all 3, so what we'll do is this week, coming up, we're working this week, we're gonna develop, we'll flesh out or develop those final ones and bring them back to this group here next week.
We just need some suggestions on, I guess, with the drop.
Okay. Okay, the location for the Dropbox, could be here, or the other location would be City Hall, is what we talked about.
Both places.
Where?
On
Both?
places.
Okay, both locations? Yeah, that's good, right? I don't know why we didn't think of that. Okay, good. Okay, so we'll do that, and then next week we'll bring you more information on that. Okay, at this point, I'm gonna turn it over to Chris, who's gonna talk about the 8 work groups. And Valencia maybe as well, right?
Really don't have too much to say other than thank you all for a successful kickoff week. We were able to kick off 7 of the 8 focus groups. So partner agencies unfortunately wasn't able to get started on Monday morning. So we'll be kicking that off this coming Monday. So really the main thing is we had 50 participants over those 7. So really good turnout from our employee focus group areas. I know that with the holiday coming up, that's going to get a little tricky, so we have had started those conversations with the groups that kicked off this week. Some of them I still need to follow up with to understand if we're going to meet after all, because again, I know as Thursday of next week approaches, maybe taking that extra day off may provide a little bit of logistical issues with getting the full group there. But I will be sending the cancellations out for the week of the closure, of course. We wanted to set up the recurring meetings so that it was on people's calendars. So just expect to see that cancellation. Going along with that, I really apologize for the groups that met yesterday, and for some of y'all that I've started to update. We had a WebEx update that happened yesterday, so I had to cancel the original request and send an updated one. So if you have folks that are thinking that maybe it was canceled, ask them to please just take a look at their calendar again, because maybe it is canceled due to people being unavailable or the city closure. But it could be also that the original request had to be canceled because of the WebEx update. So a lot to say with that. But are there any questions about the employee focus groups or any feedback from the first week? Thank you all. Take it too.
Okay, so we'll just wait for Peter to get back. I think we're pretty close to wrapping up. Does anybody have any feedback regarding those work groups? I want to make sure that everybody's comfortable with that process. I know it's very early in us just getting started with it. We've only had one for most of them. It's really beneficial to us to be able to hear from you through those work groups and come up with ideas. I mean, the simple one is just like the Dropbox. We can't possibly think of everything, so we depend on you all to help us with various ideas and things that we should be looking at moving forward. One of the things I did want to talk about really quickly, I'm following the meeting online, and one of the comments that was made, and I think if you all were watching the Commissioners Court meeting, you saw the 2 retirement systems that were presented by the county. They had a representative from the county retirement system and one from the city. And so I want to make sure that we're answering your questions and that you all are comfortable with how that retirement process is going to work should you come work for the city. Yes, ma'am.
I think it's very important, especially for someone like me who's been here like 11 years, and for those, I can't speak for everybody. Whoever feels comfortable, one of the options that they did provide was to give a scenario of becoming how much you would benefit or possibly lose of a transfer, because if a case is like that, like if I'm gonna lose quite a bit, then maybe the option based on with my income, I only want to work a certain amount of time, and I want to enjoy the rest of my life, like I'm sure you would and anybody else would. So these are things that if the city could take into consideration, I think that option that was offered to give, to do scenarios on different employees to see which one of, I think that's an excellent, option to provide us with, so that way we can see it, you know. So we can decide, oh, do we need to move and maybe find for another county, TCDR somewhere else? I mean, I don't wanna do that, because of course, that would, it's my family, and everybody's gonna suffer, you know, but we want you guys that have the ability and the power to do so, to maybe offer us an option of how we can make up the difference of that loss. Because this came all of a sudden on about, you know,
So I just want to make sure, so what she's saying, just for people, folks listening, is she's asking questions about the possibility of losing money by changing retirement plans. And I'm not sure where that came from. That's not totally accurate. The great thing about both retirement plans is that they're sister plans. They recognize each other. They're very, very similar. So the great thing about our plans is that, one, if you were to come work for, if you're a county employee and you came to work for the city, you can't commingle your money, okay? That's by law. That's not a city choice, that's not a county choice, that's the law. So you can't commingle your money. However, you don't lose your money. Once you're vested with your county retirement plan, that's your pot of money for your retirement. You come work for the city, you start a new pot. Now the great thing is that if you're already vested with the county, on day one that you come to work for the city, you're vested. So your money's going to be protected. And when you retire, you're gonna get recognized for both systems. So for the city of Corpus Christi, in order to retire, one way is to have 20 years of service. So let's say you come over, you're a 15-year employee with the county, you work 5 years for the city, that's your 20. You're eligible to retire from the city and then from the county. So you'd have 2 retirement checks coming in.
okay, and so, right, and I thought about this, too, but when I'm vested with the county, hypothetically speaking, and I discussed this with Peter last time. Let's say I have 50 grand with the county, right? I come back with the city's gonna withdraw $237, 7% of my whatever. So whatever that percentage is, 7% of each pay period, right? So I'm only contributing like $500 per month. This is all hypothetical, okay? So if I'm contributing only 500, the interest that I'm gonna earn starts with a brand new system is based on 5% at the end of the year at 500 versus 50 plus the 70, well, you know, the 5%.
Right. And
That's
yeah, so
how
it's
I'm-
really, that's a real unique situation. And so without getting everybody lost in that, your 50,000, your pot of money with the county continues to build interest. It doesn't stop. Now, granted, you're not building interest on the total amount, but you are building interest on your new amount. So is there a slight difference? Yes. Now, how do we make up that difference? Most likely in salary, okay? One of the things that we've shared with you is that we're reevaluating positions, we're looking at reclassifications for positions, and according to that market analysis, we're probably gonna see bumps in pay. That's where you're gonna make up the difference. Yes, ma'am?
Okay, but just talking about scenarios, so one of the scenarios is, you just explained, was that the person was vested in the county. What about those people that are, 1 year, 8 months from being vested and they change to city? That's what we're looking at, wanting you all to form a scenario of different situations within the county employees.
And so we can have, the best thing to do would be that for you all to hear directly from our retirement plans. I know if you were watching the Commissioners Court meeting, they had both plans there, but it was kind of hard to hear that, and you really can't get that true one-on-one conversation with them. So I think working with the county, I think our goal is to bring or have those folks available so that we can ask those specific questions. But you can start doing that now. If you wanna reach out to the retirement systems, if you'll send me, if you're a county employee and you have questions about our city one, send me an email. We'll make sure that we go through our HR department, our benefit folks, and we get those specific questions answered for your unique scenario. But, you know, we're pretty confident that our retirement systems are gonna work out in the end, that we're not gonna see losses. We're not gonna see people losing money. We're not gonna see people being negatively affected. So, you know, if you're 1 year away from being vested, when you come work for the city, you're gonna be able to apply for service credit time. Now, I'm getting really deep into this. So service credit time will apply to the other city or to the county. That's how you're gonna get your vesting.
Also, I did call TMRS, because I was trying to get ahead of him. And so I did call TMRS. The TMRS could not give me a calculation, because I was gonna do the 6 month period or whatever period y'all want to stop this. And then I was gonna ask them, okay, so can you do this? And they said, if you're not a member, I cannot do that. That's why I would like the representatives to, if y'all could pick a date, select a date, and, us come over here, present, and then they could calculate it, because they could do a fictitious, like record, and they could be, okay, let's just, basically all they need is a time frame.
Yeah, and we'll do that. So know that coming right after the break, when we come back after the new year, we'll have representatives available so that we can do exactly that, okay? But in the, for time's sake, we're gonna move forward. Adrian?
I got some clarification on the actual question. So the question is, so you're not yet vested, you're 1 year away from being vested on the county side. So if you're 8 years, that's fine, cause you're vested there, you pull out, you withdraw, you come to the county, on the city side, you're now vested there automatically. So you are eligible for the retirement on the county side. The question is, you're at 7 years, so you're 1 year away from vesting and having that retirement on that side. You come over, you're 1 year short on that side, you are not vested, you're no longer retirement. What happens to that money? That's the question that they're trying to ask.
And so I can't speak to the county side, but I'm gonna flip it, okay? I'm gonna say from our city side, how would that work? So let's say you're 1 year away, what you're saying, you're 1 year away from vesting. You go work for another entity that has a similar plan like the county. Our city plan would recognize, so you go work an additional year, guess what? You're vested now with your plan with the city. Okay, that's how they recognize their time.
I think they're asking about the match though. Did you ask about the match?
Yes, yeah, so the money and everything you already put into the county side. But you're 1 year away from vesting to where now you're eligible to receive that match. What happens to that money and that match? That's what they're talking about, that they're gonna lose.
Because there are several employees that are that far away, they're like eight months or
Right.
a year, they don't wanna lose that money that they're
Yeah,
already
that's
getting.
right. So the issue is, if people that may be new to the retirement systems is, the vesting is two things, but one of the employee Adrian's talking about is, when we talk about the TMRS of the county one, it's, we tell the employee that it's a 2-to-1 match upon retirement. So at the city side, the employee puts in 7%, and the city matches at 14%. But only if you stay with the city for how many years? 5, that's 5. So you have to vest for 5 years. So if you work for the city for 4 years, the 14% you don't get, but you do get your 7%, because it's yours, right? So the answer to that question is, it's to be determined. We need to work with the county. If I was a county, I would say, you know what, if this employee that are just months away, and there's no job in the health department in the city, or the district goes away or whatever, then I would find him a job in the county that's similar, if there is one similar. Right, so we have to work through the details.
And that is difficult for the county employees, cause
Yeah.
I did ask that question and they did
Right.
tell us, the judge told us that there would not be no reassignment.
Well, they need to be flexible, just like we
You
are.
would have to go apply for a job if there's an opening.
No, that's
Not
not
like
what.
y'all said. In the
right.
city, you said you would be reassigned, but
Right,
not
that
the
we'll
county.
work with the negotiating team, because we're not gonna leave the county employees in the lurch, right? When I make that pledge to the county employees today. So, we'll work with the county, we have a negotiating team, Jenny's actually outside, that's why I stepped out, just to see what they were talking about. There's nothing bad, it's all good, but, I don't know what they're talking about up there, but, so, we'll work with the negotiators to say, look, we need some type of help for the county employee that's this close to getting that 14% match, okay? Okay, what we're gonna do at this point is, Yvonne wants to give a quick update. We do wanna be mindful of time, it's almost 10 o'clock, so, let me check what else I want to talk about. Is Francisco here? Francisco, did you want to give any update for the county? I know Jenny's out there, but she's a little under the weather.
Just a very brief answer.
Okay, Francisco's gonna just give a quick update. He's Jenny's assistant attorney.
Good morning, everyone. My name is Francisco Zamora. I'm the first assistant of the county attorney's office. I'm speaking on behalf of Jenny. She's currently outside. We don't have too much of an update right now. Mr. Peter Zanoni has, gone over that we did have Commissioners Court on Wednesday. Most of that was an executive session, so we can't divulge or say anything that happened there. However, there was a vote that was casted, or that was placed on that day, and everything is on oasisco.com, so you can see what the position of the commissioners is, because they did vote at the end of the meeting. So if you get on oasisco.com, you can see that. And so other than that, they did request, the main takeaway is that they requested that the county attorney negotiate with the city. We are currently doing that right now. Jenny and Miles are outside, and we will be meeting again later today to discuss, to try to negotiate. The other part of the meeting that you all may be interested in has also been mentioned already, and that has to do with the retirement. We did have representatives from TCDRS, that's the county retirement system, and we did have somebody from the city's retirement system do a presentation, and they explained some of the details as to what might happen, and we are trying to work with the city to have them go over everyone's circumstances, because everyone does have different circumstances, but overall the presentation looked very positive. So please, if you have an opportunity, get on oasisco.com and see the presentation. That's all we have for today. Thank you.
Great, thank you, Francisco. And we do appreciate Jenny and Francisco. They've been real professional persons to work with. Thanks for being here, Francisco, this morning. So the sidebar conversation that was going on over here is about that retirement, that you're so close to being vested. We think that we're going to get more information from both plans, but the city plan, we know if you go to another location, they'll recognize your years of service, and you'll get the match from the other entity. If you had like 6 months to go, say, just using an example, we think that the sister programs will do the same, but we don't want to give you incorrect or slightly different information than what both plans have. So we're going to work to get the facts from both of those entities and share it with you next week. I was going to talk just a little bit about those 5 managerial positions. We know that they were posted for 2 weeks for internal candidates only. We had 2 applications, I think, per position, and Yvonne's going to talk about the hiring process, the interview process, and then the job fair company.
Good morning. Okay, so just a reminder of the positions we posted. We posted the Promotions and Support Public Health Administrator, the Prevention Public Health Administrator, the TB Clinic Program Manager, the Laboratory Manager, and the Environmental and Consumer Health Services Manager. So the holdup is that we're in the holiday season, and we're attempting to engage with external stakeholders and professionals outside of the organization to be a part of our recruitment panels. So one of the questions that someone asked me last week was, are we just gonna take the person because they applied? And so I encourage you all to know that that is not the case. We want the best person for each one of these positions. And so if you're interviewing for these positions, please prepare and bring your best. Don't just assume that it's a transition because we're modifying the process, right? And that's part of the reason why we're engaging with the external stakeholders, because when we're doing this recruitment, we want to make sure we get the best candidate for each one of those positions. So that has been our holdup. As you all know, us getting those managerial positions is what's going to allow us to move forward with recruiting the other positions that fall under those managerial positions. And one of the questions that came up in the HR focus group was surrounding org charts. So are we going to change org charts? Are we going to make a bunch of changes and add new positions or get rid of positions? So once we have those managers in place, we're going to start having those conversations to say, hey, do you have all the positions you need to be successful? I think that's why the city manager asked for more positions to be added to the budget, So do you have all the positions you need to be effective, to be successful? So you may see additional positions that we did not have before, or you may see higher numbers of the same position. We're gonna have those conversations, but we can't do that without having the managers in place. We want them to be a part of those conversations. So that is what our delay is. It is very hard to get people to come and be a part of our panels when they're out on vacation or getting ready to enjoy their Christmas holiday. And so it's pushed our timeline back just a little bit, but Steve is working very diligently to get me some names so that we can get the interviews, because I know that you guys are ready, we're ready, HR is ready to do the interviews and conduct the process so we can get the people in the seats. So as soon as we can identify some people to partner with us to engage in the process, we're gonna host the interviews. In terms of the job fair, once we have those managerial positions filled, as you know, the manager will sit on the panels to recruit the 100 level positions on the city side. We're gonna do those in a modified way. We'll come, city manager just brought up to, maybe that would be a good time to have TMRS and a rep from TCDRS present to have conversations with you guys as a part of that whole entire job fair, and we can do that. So I'll work on getting that scheduled. So that is the only thing that is hindering us. And I know that Chris sent out, I don't know what it's called, but something to get your availability for those to meet with TMRS and TCDRS. I think we only had like 19 responses. 17 responses. So we need to know your availability. That's gonna help us to get those things scheduled. So if you haven't responded, to let us know that you wanna meet with the retirement systems.
We need to send an updated one because we were targeting.
It closed out.
It closed, so I can send another one, so we'll have that discussion here.
Okay, so he'll send out another one so we can get everybody's availability, so we can pick the best day and time to do that. And then that'll help us plan out the job fair and all those things. So that is our hang up. We're not slowing down, we're still moving forward. We just need to get people to be a part of our panels so that we can make sure that we do the best due diligence in terms of filling those positions. Okay? Any questions about that?
Good morning. As part of my department, the PGP department, we have a city position, our administrative assistant, but we are grant funded. How does that work? Since our manager position for the grants hasn't been posted, how does it affect the administrative city position?
Right, so we're hiring positions on the city side, the programs that have managers.
Hiring the manager first, that goes
Or rather, it's stressing me out. No? I can't hear myself. That goes for whether it's city or county. So if the county manager position is not posted, we will not recruit for positions that fall under that program.
Even if it's a city general fund position?
Right, even if it's a city general fund position, because honestly, once that manager position, even on the county side, is hired, they may say, hey, we don't need an administrator, or we don't need an executive assistant, we need this instead, whatever that title may be. And so we have to brainstorm in that process, but we need the manager position to be filled first. The process is not gonna change, whether it's the county side or city side. We're gonna hire from the top down. Okay?
What is the timeline looking like for the grant programs?
Right, we'll have a better answer for you next week, but, now that, things are slowing down a little bit, I'm gonna be working with Steve. They have some general, calendar concepts, but we need to nail them down, because you well wanna know, we need to know. So I don't have the answer today, but it's gonna be, the grants we're thinking is gonna be not the last, but it's gonna be further along in the work process. So we're gonna try to do some of these easier things, just begin the transition. And then we know the grants, there's 10 different grants, I think 40 employees, 45 employees, or something along those lines. So we have to get the granting agencies to talk to, see if we can, there's a lot more work to do on the grant, so it's gonna take the longest. We're working on them, I should say, though, now, or we will be. But because there's more conversation, we may have to go to council to reassign, or the commissioner's court to reassign. It's probably gonna take a little bit longer. But all that to say, next week we'll have a better time frame for you on the grants. Gilbert, you have a question?
So to piggyback off Maureen's question, so will that same rule apply for the administrative staff under the director and assistant director?
And I didn't hear Maureen's question.
So about the manager positions that aren't posted, so those administrative positions won't post yet? So will the same rule apply for the administrative positions under the director and assistant
Wait, to
director?
fill the director first?
Yes,
So,
director first,
yeah,
yeah.
right. Yes, the answer is yes, Governor. The question was for the administration, say the director, assistant director for the support staff, when will we decide on those positions? And in part, we'll wait till we get the new director to see. They may not want, right, to use Bond's example, an administrative assistant, maybe they want an assistant too, or something like that. Okay? Okay, so, Yvonne, thank you. And we talked about the director. Oh, one other thing I wanted to mention, the concept of the county's concept that the Commissioners Court approved, which is that the city takes over everything and the district still remains. Even under that scenario, we would still have everybody reapply for their job. Okay, just to point that out. So the reapplication for the job, the selecting people for the positions would happen in either scenario, just to let you know. That includes the director, assistant director, and all the staff.
They will all remain internal?
Yes, yeah, except for the executive level positions, we're gonna still use that recruiter.
The only reason we would post externally is if we do not find a candidate internally.
Okay.
So
The
it'll be
bond
internal
added-
only first.
Yeah, internal only first, if for some reason that maybe people don't apply for that job, or, the candidate that did, or candidates that did weren't at the level that, we're hoping for, then we would have competition from the outside as well. Okay, let's see, so, let's talk about, I think we're almost done here for this meeting. I want to talk about schedule, and then we'll see if there's any other questions. So, you guys have to answer this question if you want the following, which is for us to come back next week. The plan for next week was to come back on Thursday, the 23rd. And you won't hurt our feelings if you say no, we don't want to see you guys again. We're too busy focused on Christmas. So we could come back next week, but I know like this week, the judge came here twice, and we didn't know about it, but I'm here today, and you know about it. So we don't want to overdo our welcome here, right? We do want to over-communicate, but did you want us to come back next week, Thursday?
Let's skip next week.
Skip next week?
Yeah.
Is there any anticipation that there will be any new information by
Yeah.
then?
The only thing we'll get you next week was, we're looking at something next week. Oh, we'll get you the information maybe through Chris and through the email. We have an email grouping, right?
Correct, yes.
For both city and county employees. We'll get to you early next week, Monday or Tuesday, the location that you, the concept that you asked for, which is anonymous drop boxes, if you will, that's suggestion boxes, I guess. So we'll tell you the three, where they are, kind of what they look like. That is a traditional ballot box or suggestion box in actual physical form. We'll have one here at the Health District Building, one at City Hall, and then we'll tell you the QR code electronic one or using technology. We'll email you that, send you those directions or instructions, and then the helpline as well. We haven't decided if we use the auditors or the human resources, probably the human resources, but we'll finalize that and we'll put that as well. So those three things will be in an email to you then next week. So we won't be here next week, the Thursday as we had initially said. And then there's no meeting the week of the 31st because the city is closed that week, right, for non-essential services. And then our next meeting will be January 7th. Then that first week back in the new year, that'll be Friday at 9 o'clock. And so everybody knows, we'll let the county know. And as always, we'll be very transparent with our recordings and live broadcasts. Yes, ma'am?
All those sources that we're gonna do, the box, the QR code, and the hotline, these are all gonna be only for health department employees, or is it gonna be for public too?
Well, they were meant for you all. The idea came from the city, the county, well, came from the district employees. But we could.
QR code for sure.
Yeah.
Anyone can call the audit line or the human resources tip line.
Okay.
Can I clear something up on the QR code?
Yeah. That's a good concept though. Maybe we do have, because we do have outside focus groups, with the healthcare professionals. But any citizen may have an idea, so it's a good point. Maybe we have an online, was that what you were talking about? Yeah, okay.
So on the online, what I'm doing is, if you've signed up for the focus groups, you're already familiar with the Office 365 tool. It's kind of like a Survey Monkey. So we'll be doing something similar with this. But one thing that I do want to preface, because it is completely anonymous. I have a screenshot. I beta tested it yesterday with Valencia and myself. If you're signing up using the QR code and you haven't used your phone to access your Office 365 in a while, it will ask you to enter your email and your password. but we don't see any of that. So I have a screenshot, I can show you that it is completely anonymous. And what I'm including in the online format is if you want to be contacted for additional information, there you can opt into that. So it is anonymous unless you decide to include your name and some contact information. If somebody from the city, if you would like somebody from the city to talk to you a little bit more. So again, I assure you it's anonymous. I have the screenshot to show you that we will not know who submitted it unless you answer that second question. Are there any questions about how that QR code or how that form would work? Okay, cool, thank you.
Can I ask a question on the QR code? Does everybody know how to use the QR? I don't use it much, but I wanted to ask, make sure you all do. Yeah, right, I've used it before, but I don't, some people use it a lot.
I'll also include a link, so we'll have the QR code if you choose to use your phone to fill it out. But if you're sitting at your computer desk and you would like to fill out the form that way, there will also be a link to click. So there are going to be these two options, electronic.
It'll still be anonymous, the link?
Correct, yeah, both will be anonymous.
Is that link gonna be on that SharePoint page? Where
We can,
everybody places these
I'll talk to
things
you.
without having to do?
Well, but if we're gonna send that communication, we'll have it there, and then we can also, I think, put it on the hub. Yep.
Okay, and then we have, and what was your name again? You, yes. Carmen, so Carmen had a good idea, and we're gonna add that, Chris, to the work plan, which is a community portal. So if any citizen wants to give us input, we'll be glad to get it. We are gonna have a group of healthcare professionals that are gonna be meeting in January to give us input. They asked, they said, hey, we wanna be part of this, how can we do that? So, like, we'll have our employee focus groups, we're gonna have healthcare professionals, persons that run the hospitals and some of the nonprofits, so we're gonna meet with them. But the average community resident may wanna give us some ideas, and so we'll put a community portal as well. But we'll have one that's exclusive to you all, although Yvonne says that the phone number anybody can call. So you all will have access to the QR code, which will be internal only, the telephone number, internal and external people can use it. And then the paper ballot box, I guess that could be either, we're not gonna be monitoring it, so you could get some community there. But to add to the QR code, we'll have a link for the community that, it could be an employee that uses it as well, but it'll be accessible to the community. Okay? Okay, we're at the end of the meeting time. I just want to see if there's any questions. Is anybody, I was looking at my watch and was just reminded mentally of a big event today. Anybody going to the Cole Park Pier? Ribbon cutting? Does anybody fish in this room? Well, the Cole Park Pier down there in Cole Park, we're going to have a community celebration to cut the ribbon to open the pier. That's today between the hours of 4 to 7. There'll be a live band. What is the name of that band again? It's a big band, it's like 10, 11 piece band. They'll be there playing live music, and we'll have a DJ when the band's not playing. There'll be hot chocolate and cookies, and access to the pier. What is it called?
Free fish fry?
Ooh.
Free fish fry?
Oh, yeah, yeah, no free fish fry, but we are giving out a lot of free giveaways, so fishing rods, for the first 300 people that show up, there'll be a commemorative postcard commemorating the pier, and a free backpack, pretty nice, they gave me one yesterday. So you can get that if you're one of the first 300. Parking's gonna be a little bit difficult, right, it's limited already down there, but there's a free park and ride.
Can we leave work early to go get one?
What's that?
Can we leave work early?
Yeah. And that's not here, right? We're here, 4 o'clock. Yeah. There's no cameras in the parking lot. Yeah. Unless I hear from Annette, go for it. Do try to come out. I think if you leave a little bit early, it's not bad. The event starts at 4, but the main event starts around 5-ish. Actually, 4:30 is when the mayor will start to speak, and council members and a few others will speak. So around 4:30, if you want to be there for the ribbon cutting, be there by 5:15. Around 5:15, that's when we'll cut the ribbon. At that time, it's getting a little bit dark out, and as the ribbon's getting cut, the lights will be turned on. So that big arch, has anybody seen the arch?
Yeah.
So the Cole Park Pier, I didn't know until the other day when I pulled up, but that's illuminated. So that, those lights will turn on, all the lights on the pier and the nice big plaza. So, yeah, come on down tonight between 4 and 7. It's a beautiful addition to our community, and it's a good example of improving what we do as a community, right? And it's a good model for this health district, because the pier was not, or is not, like it used to be. Before it was pretty bland, too narrow, really no amenities, no lighting. Right, terrible. So this is the guy that's building the pier, well, it's Jan Davidson, but the foreperson, the foreman, who's built many piers in his life. He said, I built a lot of piers in my life, but this one is the best one I've ever built. Yeah, very solid. And it's got a lot of different textures and colors and amenities and shade and lighting in a big plaza. So when you do go to it, because I know pretty much everybody here will eventually, keep that in mind for our health department, that we don't want the same business, we want something better.
Yes.
Right, so, good way to end this meeting. We'll see some of you at Copart Pier.
4 o'clock.
4 o'clock.